How much do you really know about the health complications associated with obesity? More often than not, obesity is misunderstood as a mere concern for physical appearance, but the reality is far more grave. Obesity is a silent predator, preying on multiple organ systems and escalating the risk of chronic diseases. Let's start with cardiovascular diseases. Obesity acts as a catalyst, increasing the risk of heart disease, hypertension, and stroke. It's like adding fuel to fire, escalating the levels of cholesterol and triglycerides, which are the main culprits behind these conditions. Then we have type 2 diabetes. Obesity is a significant risk factor here, paving the way for insulin resistance and eventually type 2 diabetes. It's like a domino effect, with one problem leading to another, disrupting the body's natural harmony. Moving on to respiratory issues. Obesity can lead to obstructive sleep apnea, characterized by interruptions in breathing during sleep. It's as if your body is fighting for every breath. Moreover, obesity can decrease lung function and increase the risk of asthma, making every breath you take a struggle. Next up, musculoskeletal problems. With obesity, there's increased stress on joints, leading to conditions like osteoarthritis. It's like carrying a heavy backpack around all the time. The added weight reduces mobility and physical activity, making even simple tasks feel like a chore. And finally, let's talk about metabolic syndrome. This is a cluster of conditions including high blood pressure, high blood sugar, abnormal cholesterol levels, and abdominal obesity. It's like a ticking time bomb, each condition amplifying the others, creating a cycle that's hard to break. So as we delve deeper into the labyrinth of obesity, we realize it's not just about how we look, but about how we live and how we feel. It's about the silent battles our bodies are fighting every day, and we've only just begun to scratch the surface of how obesity impacts our health. If you thought those health issues were concerning, wait until you hear about the rest. Obesity can lead to severe gastrointestinal problems. Non-alcoholic fatty liver disease and non-alcoholic steatohepatitis are two such conditions where fat accumulates in the liver, impairing its function. Obesity can also heighten the risk of gallbladder disease. Next up is cancer. Yes, obesity can significantly increase the likelihood of developing certain types of cancer, including breast, colorectal, and endometrial cancer. The excess fat in the body encourages the production of hormones and inflammatory substances that can foster the growth of cancer cells. The psychological and social impact of obesity can be equally devastating. Many people with obesity experience depression, anxiety, and low self-esteem, often as a result of social stigmatization and discrimination. These emotional burdens can form a vicious cycle, making it even harder for individuals to manage their weight. Obesity doesn't stop there. It can also wreak havoc on reproductive health. Women may experience menstrual irregularities and a reduced fertility rate. Both men and women with obesity face an increased risk of complications during pregnancy and childbirth. Chronic low-grade inflammation is another unseen consequence of obesity. This persistent inflammation can contribute to a host of health problems, from heart disease to diabetes and even cancer. It's like a silent alarm constantly sounding in the body, signaling that something is wrong. Lastly, obesity can significantly decrease quality of life. It often leads to reduced physical functioning, making everyday tasks a challenge. It can limit mobility, making it difficult to enjoy activities once loved. And it can lead to a general decline in overall well-being, casting a shadow over one's life. So as you can see, obesity is a serious health concern that goes far beyond just weight. It's not just about looking a certain way or fitting into a certain size. It's about the unseen, yet profound ways in which obesity can impact nearly every aspect of health and well-being. It's about recognizing these risks and taking proactive steps to manage them. It's about embracing a healthier, happier future. But it's not all doom and gloom. There are ways to combat obesity and reduce these risks. Recognizing and addressing obesity early is crucial to prevent or manage its complications. A comprehensive approach can make a world of difference. It's like putting together a jigsaw puzzle, each piece significant in creating the whole picture. Imagine lifestyle modifications as the corners and edges of this puzzle. They provide the framework for a healthier life. These could include better sleep habits, stress management, and quitting harmful habits like smoking. Dietary changes are the next pieces. They involve consuming balanced meals, reducing portion sizes, and incorporating more fruits, vegetables, and whole grains into your diet. Increased physical activity is another key piece. It could be as simple as taking the stairs instead of the elevator, or parking a bit farther from your destination to get in some extra steps. Lastly, consider medical interventions as the final piece that ties everything together. This could range from medication to surgery, depending on individual needs. It's crucial for individuals with obesity to seek guidance from healthcare professionals for personalized advice and support. Remember, the journey to better health begins with the first step. Take that step today. Let's quickly recap what we've learned about obesity and its health complications. Obesity is a significant concern, linked to a range of health issues affecting multiple organ systems. It increases the risk of cardiovascular diseases, type 2 diabetes, and respiratory problems. It can lead to musculoskeletal issues, metabolic syndrome, and gastrointestinal complications. It's also associated with an increased risk of certain cancers, psychological and social impacts, reproductive issues, chronic inflammation, and a decreased quality of life. The importance of addressing obesity cannot be overstated. A comprehensive approach, including lifestyle modifications, dietary changes, and increased physical activity, is integral to managing and preventing these complications. In some instances, medical interventions may also be necessary. Always remember to seek guidance from healthcare professionals for personalized advice and support. Thanks for watching. Remember, your health is in your hands. Take control today, and don't forget to subscribe for more health-related content.